after the 5-year forward view was presented by Simon Stevens, an initiative came out of NHS England for application for funding, and 29 sites or providers of care applied and were awarded Vanguard status. What that actually means is that they have been given the licence to look at new ways of delivering care to patients by integrating primary care services such as general practice and secondary care services, which is what you would usually receive in hospital.
The biggest need for new models of care is the ageing population. Budgetary constraints are also putting severe pressure on the NHS. But the ageing population and the size of our population is creating a phenomenal pressure point on A&Es and hospitals. And our responsibility in the healthcare system is to try and keep patients out of an A&E and help them get out of hospital quicker. And we believe the models that we can develop as part of this will let that happen, will make that happen right across the NHS. I also think, you know, when you look at our healthcare system in the United Kingdom, we should be very proud of it. But it is now facing those challenges. And brave companies and brave people need to innovate to take those challenges on. Community pharmacy can do many things for the NHS. And we're excited about a number of things we're doing, and one of them being the First Care Clinic. And to me, treating minor ailments and becoming the go-to place as a pharmacy for people with minor ailments should be absolutely passionately driven. I think patients and customers will love it, but there is a default gene in us that sends us to an A&E the minute we have a problem or to a doctor. And we know both of them are overloaded and the resources are thin. I think if we market local pharmacy strong enough and we release the skills and competency of pharmacists, I believe they become a destination to help people live healthier lives, particularly around minor ailments and concerns they might have with their health. But that's going to take brave people who are unorthodox in the way they think and passionate about making it happen, and putting together a model that rewards those pharmacists who do it properly. And also other areas of our healthcare system, like doctors saying, okay, we'll hand over some of this to the pharmacists, and that will release our time to deal with more difficult regimes in our surgeries. I think sticking pharmacists in a doctor's surgery is a fantastic idea, but that's not the end of it. That's not going to finish it or complete it altogether. So the government needs to look further and broader, and we're willing to work with them on many, many initiatives and ideas.
LloydsPharmacy have always been involved with community healthcare, especially within public health services. So we've been involved very much within diabetes, substance misuse programmes and NHS health checks. However, we've decided that LloydsPharmacy now has to step up to help Vanguards deliver new models of care, and we've been piloting some really exciting initiatives. We are working with a number of Vanguard sites on how we can potentially manage some dermatology patients, minor illnesses, and also to prevent COPD exacerbations within patients by providing them with care and advice when they come and collect their prescriptions. Patients are used to going to see their pharmacist when they go to get their medicines, so relationships are already there with their local pharmacist. They're in the heart of the community, they're accessible, it's walk-in and it's available. So the more services that are available in pharmacy absolutely benefits the patient, because it means that it's more convenient and they can manage their healthcare instantly rather than having to wait long times for appointments. We'll definitely see an increase in the use of digital services within healthcare, and LloydsPharmacy Online Doctor is massively well positioned to help with that. We are working with some organisations, some healthcare organisations within the NHS on how we can utilise LloydsPharmacy Online Doctor within their healthcare system, so that's really exciting. So there'll definitely be an increase within healthcare services online. I also feel that there's a real opportunity for long-term conditions to be managed more closer to home, with a massive role for pharmacy to help support patients within self-care and managing their condition through lifestyle choices, and also whilst they collect their medicines, talking to them about their condition to prevent them having to use hospital or GP services. So I definitely think there's going to be far more community-based long-term condition management.